Angelo, hi, it's Kathy here from IMCO, from the International Integrative Maternity Healthcare Organisation, and welcome along to this week's Maternity Natural Health webinar. And this week we have the lovely, beautiful Julie Mogbo. Say hello, Julie.
Good evening, good morning, good afternoon, depending on where you're joining the call from. It's a pleasure to be here. Thank you, Kathy.
It's so lovely to have you along. And so for those of you who may be watching this webinar a little bit further down the track, rather than live, just to sort of go over and reintroduce Julie to you. So Julie Mogbo is an advocate of healthcare improvement with a primary interest in the spectrum of care surrounding childbearing families. And Julie is the founder of Family Bond Nursing, which is a care concept I'm sure she'll talk to you a little bit more about, which leverages some connections and relationships to improve health incomes. And she's been a board certified nurse since 2008 and has since positively impacted hundreds of children and parents and other nurses. And the topic that we're going to be talking, or she's going to be talking today about, is strengthening bonds for a better perinatal experience. And of course, for anybody who is watching this who is not a maternity health professional, that word perinatal really covers, pregnancy, birth, postpartum. It's the whole gamut is perinatal. And often sometimes that word is interchanged a little bit with maternity. So strengthening bonds for a better maternity experience. So this particular webinar today aims to create a bit more awareness on the systems that can really influence a pregnancy and newborn care, and how they can be best managed to promote that well-being of both the mother and the child, and to prevent postpartum depression, which is absolutely rampant, which I'm sure Julie will talk a little bit more about. So we're going to be talking about prevention for that family unit. And so, let's start at the beginning there. And what is the story, Julie, behind the concept of strengthening bonds, for a healthier perinatal experience? Do you want to just sort of go over a little bit about, your background and how you came to be doing what you're doing?
Thank you very much, Kathy. It's such a pleasure to be here. So I started my journey, first of all, into nursing when I was about 12 years old. That was when the seed for caring for people was first conceived. So this happened when I lost my dad to medical negligence. And as I grew older, I got the information that at the time when he had an accident, the private medical practitioners were on strike. So they weren't working. The public, those in the government sector, yes, were not working. So we only had the private medical practitioners at the time. Unfortunately, the facility where he was taken to were not equipped either by human resources or by the equipment. They were not equipped to handle the condition at the time, and that was the case of a spinal cord injury. So he was kept there for some days without medical treatment. Somehow, my family got to take him away from there. And when they took him to a tertiary institution, that was a decision taken too late, and he passed before further intervention. So when I heard that, I felt that I needed to do something to prevent such occurrences, to prevent families from going through the pain that we went through as a result of our father's death. I thought in my head that if we had passionate nurses or doctors on duty at the time, they probably would have informed my family and told them, you have a right to take your patient away from here, or we're sorry, we cannot manage this. I would suggest you move him to a tertiary institution. But they were not given that information, and that led to his death. So when I started my journey into nursing, I got to discover that a number of challenges patients were experiencing had little or nothing to do with the diagnosis that got them admitted in the hospital in the first instance. For instance, we have people admitted for high blood pressure, kidney problems, and all that. But when on close interaction with these patients, I discovered that there were so many psychosocial challenges. There were emotional problems, there were mental health related problems. People had issues with family relationships, financial challenges. They had issues with unemployment. A number of these things were the main challenges for patients. So I decided to start educating families, individuals on how they can live healthily and how they can prevent certain medical complications. And if at all they find themselves on a hospital bed, if they find themselves admitted in a hospital, how can they prevent further complications? So that was how I started my journey into helping people establish a strong network in order to prevent illnesses. And my passion
Wow.
for childbearing families got more ignited when I started having my babies. So it was nothing prepared me really for pregnancy. Nothing prepared me for the challenges. Nothing prepared me for the time that I was going to spend to take to nurse my baby. I thought that, okay, once I get pregnant and I have my baby after 9 months, I'm going to be free. But no, once you're pregnant, once you're pregnant, you don't have yourself anymore. Just keep aside almost 2 years of your life to
Yeah.
care for the
It's so
baby.
often the
So
story,
when you're
isn't
just,
it? When women are
yes,
pregnant with their first and they think that as soon as they get through the birth, then that's good and everything's fine. And then they can move on. And well, they do move on, but it's a whole, you've swapped one lot of complexities of being pregnant with a whole big new set of complexities of managing the care of a newborn. Yeah, absolutely.
yes,
And it's so often the case that it is when we have our own children that it ignites that passion. And to in the topic of maternity, I'm so sad. We all would be listening to your story of what you and your family went through, with the passing of your father. That's just horrific. And um, again, so often we have speakers here who it is something that's triggered in their life where, they were kind of the victim of something, then they became the survivor of something, and then they become the warrior of change, that something doesn't occur with somebody else. And, it improves, it's that evolution of improvement. And, so it's, it's awful that you went through what you went through, and it's beautiful that it's turned into something that's become, your career. And I'm sure your father would be looking down and just thrilled at what, you've taken from his passing. And of course, then becoming a mother gives this whole new maternity slant of passion, of interest. So how crucial, I know what I think, but how crucial in your opinion, is that support system to the well-being for pregnant women and their fetus, or their newborn?
it is crucial because the World Health Organization, they did say that a midwife supported pregnancy has a 80% chance of being successful. So the World Health Organization is encouraging that a pregnant woman receives all the support, both from skilled professionals and from family members as well. I would like to say that each stage of pregnancy, childbirth, and postnatal period should be a positive experience,
Mm.
and one should ensure that women and their babies reach their full potential for health and well-being. And in order for this to happen, there has to be a structure put in place. Like in my experience, and many women, pregnant women and mothers all over the world, nothing truly and really prepares us for this journey. And every pregnancy is a different story. It's uniquely different. And no two pregnancies are the same. So the fact that one had a smooth pregnancy in the first one doesn't guarantee the smoothness of the second one. So they all come with their different drama. So each time there is a need for support before, during, and after. And it's important to have this kind of support because the pregnant woman has a lot of feelings. So before she gets pregnant, she probably was a career woman. She had projections for her life. She had aspirations and all that. And then pregnancy steps in. How many women truly and really plan for pregnancy? So sometimes they just wake up and discover that they are pregnant. And even those that are anticipating, they're not really ready. So when the baby comes in, so the woman starts realizing that, oh, I can't go to the places I used to go before. This is actually really particular to Africa and Nigeria as well. And it may be the case in many other countries. So you're pregnant, you can visit the places you used to go, you can't engage in the activities you used to do before. And by the time you have your baby, you're wondering, you need all the help. You can't go back to work. You probably do not have the required maternity leave to be able to take care of your baby. And then most importantly, for many mothers, is the support of the partner. So studies have actually shown that the support from the partner of a pregnant woman it is suggested to have a positive impact on the pregnancy and the child. So there was this study that was carried out by some Chinese scientists on a placenta. So the placenta was placed in a chaotic environment where there was violence, there was introduction of chaos, and it was observed that each time there was a chaotic movement, sound, and all that, the placenta shrunk. And then where there is calmness, cool music, serenity, and peace, the placenta will seem to relax. So this suggested that the baby, the fetus in the womb, takes in the energy from the external environment. So where a woman is supported, surrounded by love, by those who care for her, those who make her happy and reduces her stress, if she's not subjected to stress, then it's a higher chance that the pregnancy will go smoothly, the outcomes will be positive, and the fetus will develop as the fetus should develop. So it is really crucial, especially because we have a high rate of maternal mortality. And according to the World Health Organization, approximately 810 women die from pregnancy related conditions or problems. So it's important for the pregnant woman before, during, and after to receive as much support as possible so that that period goes smoothly and the chances of her having a positive pregnancy experience and having a healthy baby increases. So this is how important it is for a pregnant woman to have a support.
Absolutely. You've so hit the nail on the head. And, we've got women in the world who are pregnant and don't have access to excellent medical health care. And that's horrific, and it just shouldn't be that way. Um, but we've also got women who do have access to excellent health care, but they're creating their own stresses, and there's almost assumption that their pregnancy can handle whatever they're throwing at it. So, whether they're working 50 hours a week in, because they were in a stressful job, and they're still, the alarm clock's going off at 6 a.m. So they're on the train at 7, and they're at work at 8, and they leave at 6, and then they get home at 7, and, and they're doing this. So it's kind of, in a way, in countries where there is not, where the women know that they're not having perhaps access to the best medical health that they should have, there's perhaps a little bit almost more respect of how precious and fragile that pregnancy is. And then in the extreme opposite, in some Western countries, a lot of Western countries, we see the opposite, where the woman is, because they do have access to all this medical care, they just push their pregnancy, they stress their own pregnancy through this weird kind of obligatory kind of feeling that they still should be able to maintain the equivalent of their non-pregnant life right up until a month before they're due. At 36 weeks, they'll stop working. And of course, we all know that's not a month before they're due. That's 1 week before they're due, because they're due from 37 weeks onwards. And I know that with my own practice, that every single woman who ever gave birth prematurely was a woman who was still working full time. So, it's this terrible situation that we kind of women are setting themselves up for these stresses in the pregnancy, as well as women not having access to that medical care, which provides the stress. Yeah, it's tricky. I mean, and I know in your description, you state that pregnancy is a family affair, and I guess it's you're so right, and you're so right when that how important particularly that partner is in engaging in the pregnancy and the birth and postpartum. But I guess what do you feel is that implication on the healthcare delivery and pregnant women and the family members? What do you see as that whole big picture?
So thank you very much. So for healthcare delivery, it's important that the healthcare worker, the hospital management would provide as much of a quality service as possible. So on the part of the healthcare professional, they need to get the skill, because the greatest needs of the pregnant woman, there's a need for information. She needs to be educated. She needs to be very aware, well informed about the different stages, the expectation, the symptoms she's going to be having, the possible outcomes of her pregnancy, and where there's a threat of certain complications, she needs to be aware of the options available as an intervention. So there's a need for information, and the skilled professional, healthcare professional, owe it to her to give her that information. Then there's the need as well for emotional support. That emotional support as well could come in from the healthcare workers. Back here in Nigeria, it used to be common then, when pregnant women go into labor, they get into the hospital, rather than get the love, the support, the encouragement, the motivation, they they get a negative treatment. So there's so many horrible stories during labor, and that is gradually changing. We have been educating the healthcare workers, the nurses, the midwives on how to manage pregnant women when they come into the hospital. So it's necessary for healthcare workers to get the right information on how to properly educate the pregnant women when they come in. then the hospital itself needs to be adequately equipped to handle complications. We still have women dying from preeclampsia, they're dying from postpartum hemorrhage, and these are things that could be taken care of, it could be prevented. So the hospital needs to think ahead. What are the prevalent causes of maternal death and how can we prevent them? Do we need to send our workers or our staff for more training? It's important for the hospitals to have these conversations and get themselves ready as an institution and then get the workers as well ready. Then for the family, yes, pregnancy is a family affair. And it's important for family members to understand the minute a child is born, the single woman takes up the status of a mother. She is no longer single alone, so she becomes a mother. Then her siblings automatically become uncles or aunties. So there's a connection because there's a newcomer to the family. And if there are children already in the home, automatically they become siblings because there is a newborn child in the home. So there is a connection to that baby. And the support is needed for the pregnant woman and the baby. So everyone should be anticipating, should anticipate the coming in of that child because one way or the other, they are connected. Their status is changing because a baby is about to be born. So you hear people celebrating, oh, I'm going to be an auntie very soon. I'm going to be a big brother very soon. I'm going to be a big sister very soon. So it's not just in the change of the status, it also requires emotional support. So healthcare delivery, family members for the positive experience and better perinatal experience, pregnancy experience, postnatal experience. It's important for us to identify what our roles are, what our responsibilities are. So the healthcare professionals, like I said, need to educate the pregnant woman, provide her the information. The management, all stakeholders need to ensure that the equipment, the hospital is well equipped to manage pregnancy, provide them with all that they need, and then take care of any pregnancy related complications. Family members need to be available as well to provide their support to the pregnant woman. And then in the society, the community, we cannot turn a blind eye to the needs of the pregnant woman. What if she is on a bus or on a train or in an aircraft on board in the air, and then suddenly she's experiencing contractions? What are the measures put in place to ensure that she is adequately taken care of and her life and that of the baby is safe? When you step out into the neighborhood, you go to the shopping malls. How many of these shopping malls make provision for the care of the young mother, the woman with a baby? I say this as because I had an experience when I had one of my babies. When I had one of my babies, I had to attend a seminar. So when I got there, I was there quite early. It was yet to start. And then my baby messed up his diaper. So I had to go to the restroom to have him changed. So when I got to the restroom, I couldn't find any place to lay my baby and change the diaper. So in a bid to manage the situation, I mistakenly, his feet, he was always moving his feet, and then he turned on the tap and he got wet. So I had to change his clothes. I went on to the management to talk to the management, and I went there twice, three times. They did nothing about it. So we find few of these organizations pay attention to the needs of pregnant women and childbearing families. Make provision for them at the restaurant. There should be a baby carrier. There should be the baby chair where the families can afford to go out because there's provision for their little ones. So I can go to the restaurant and have a comfortable place that my baby can stay in. So this shows that we pay attention to the needs of pregnant women. We are particular about their well-being and their health. So these are a few reasons we we need to pay attention and make necessary provision for pregnant women so that we don't see it as a punishment. I mean, pregnancy is not a social, it's not a disease.
Oh,
It's
I
part
love
of
your
life.
word.
It's
So,
expected.
yeah, saying that it shouldn't feel like a punishment. It's that's so accurate. I remember, I mean, these days when I go to the supermarket, there are a lot of the trolleys, the trundlers that the shopping carts that have baby friendly seating on the top of them, which is great. But they crazily, that didn't exist when my children were tiny and needed that. It was just it was only one kind of trundler. And
Yeah.
I kind of look at it now when they put the babies in, and it's so much easier. I'm like, I wish I had that back then. But it does feel like a punishment sometimes. You feel like, in a way, it's like when we look at, say, facilities for disabled. So, now when a new building is built, a new public building, there's always the thought of, where's the ramps, where's the escalators, how are we looking after those that are in a wheelchair? How are we facilitating so that they don't feel like it's a punishment that they can't get into the building because they need a ramp. And in the same way, it's like we need to be doing that with our mums, because it is silly. We do still feel like it's a punishment. There's how can you have
Yeah.
half the population being female thereabouts, and most of them end up having children at some point, and we have so little facilities and so little thinking and mindset, as to how we're making life just not easy, but just reasonable.
Reasonable.
Well,
Reasonable.
let's just make it
Reasonable.
reasonable. um yeah, so now another thing, of course, that we haven't broached the topic of yet is those you know situations where women are having frictional, family relationships, where things are not great at home, for whatever reason. And look, it's funny because I know that, so often women, when they're pregnant, will be dealing with some drama in their life that they can't necessarily get rid of. Look, it could be that their mother-in-law is dying, or that their husband has just lost their job or something. But there'll be dramas and life events and tough times that they're dealing with, and often they can feel like almost like, why is this happening to me in my pregnancy? All these other women can be pregnant and not have to deal with stuff. And it's
Yeah.
my one time that I'm now pregnant, and I'm having to deal with this. And there's almost um, a sadness of, why me? Why can't I just have a normal pregnancy like everybody else? Or, maybe
Yeah.
that they've got complications in the pregnancy. Maybe there's gestational diabetes noted very early on, or maybe they've had an anatomy scan where there's a question mark on things, and there's like a, why me? Everybody else is having a wonderful pregnancy and I'm not getting that. And the truth is, as you know, and I know, that's not the truth. And for practically most women, there will be something in that pregnancy that they're dealing with that is tough. And it could be something going on the outside. It could be something to do with the pregnancy, but most women have a emotional roller coaster that they're going through. And or if the pregnancy is all smooth sailing, maybe there's a complication in the birth. Or if the pregnancy and the birth is smooth sailing, probably it's going to be something's going on in the postpartum. But there's always
Yeah.
these mountains that have to be climbed. And every so often, um as a full-time caseloading midwife, I would do sort of 70, 80 women a year. And uh, I would say that probably less than half a dozen a year would have a really quite normal, uncomplicated pregnancy, and family life is good, and the birth is lovely and normal, and the postpartum goes fine, and breastfeeding establishes beautifully, and everything kind of works, and it's tickety boo. But it's the great minority. Most,
Minority,
right?
minority.
Most women deal with some challenges in that journey.
Yeah,
It's almost a year long,
yeah.
that journey, and it's a long time for there not to be some stuff going on. And
Hmm.
but when we get back to that relational friction situation, which can be so tricky and beyond their control, and not necessarily the partner, it could be the mother-in-law or something else. But how,
Yeah.
in your, with your practice, how are you suggesting that they do establish relationship bonds, to and so they can get that support that they need?
All right. Thank you very much for that question. So maybe I would use this opportunity to kind of explain a little bit what the family bond nursing is. The
Mm,
idea of
yeah, that
family
would be
bond
great,
nursing
too.
is, yes, yes. The idea of family bond nursing is to help individuals and families experience better health by leveraging relationships to bring about better health outcomes. So that's what it is in summary. We usually say that bond is not necessarily a blood connection. So we understand that family is who is related by marriage, by blood, whether it's by birth or by marriage. That's a simple definition of a family. But then, what if the biological family isn't working? What then
Mm,
happens? What if someone becomes an orphan, no parents, no siblings? What if that person is an only child and then growing up loses both parents? So what then happens? What if there's no link to any biological relative? What then happens to that individual? So what we are saying is that identify the relationship, the positive relationship that is working. The biological relationships are really important to us, but we do not have absolute control over the trajectory of that relationship. So if the biological relationship isn't working as expected, can you identify a positive social relationship that you can leverage in order to gain strength, in order to have clarity, in order to strategize and and discover ways in which you can manage, work on the biological relationship you so very much crave for. The idea is no man should be an island. No one should suffer alone. There should be some form of support. It just has to be positive. So for pregnant women who do not have that kind of support, for pregnant women who are having those dramas in their relationships, their family relationships, what we're doing is to let people know, both men and women, that once you are a human being, you have an emotional deposit in the lives of everyone you have ever come across in your life's journey. And because you have made this emotional deposit in them, there is that connection. You cannot just discard them. You cannot just pretend they do not exist. There is a need for us to nurture those relationships because the time might come where when you might be needed or you might need someone. So what happens most times in Nigeria and maybe some other countries is that once a person gets married, it is expected that you sever other relationships that you've had. Face your spouse. Now that you're married, you need to cut off from this group, cut off from that person, just focus. on your spouse. This has its downside. When there's financial problems or challenges, who do you talk to? Who do you learn from? Who do you lean on? When there are emotional challenges and maybe the source of stress is from a spouse, how do you get stability? How do you get strength in order to deal with the challenges you're confronted with in-house? So for the pregnant woman, it's important for her to know, first of all, that she is not alone. And in family bond nursing, we usually say pregnancy is a family affair, and that's what is said in family nursing as well. That pregnancy is a family affair. So we do not refer to the woman as the pregnant woman. So we say they are pregnant. So it's the woman and her partner. Let's have in mind that not all pregnant women are married. Not all pregnant women are married. So the pregnant woman and her partner, the pregnant woman and her spouse, the pregnant woman and any significant other, someone who has decided to stand in the gap of the father of a baby. It is their business. That pregnancy becomes their responsibility. And the way they can play a part is either to run errands, provide the emotional support, be available for the pregnant woman when she might need that help. So for the one who is finding it difficult with family relationships, let her look out for her friends. If they didn't have that network, if they cut off and if they sever the cords of every other relationship before they got married, before the pregnancy, it's never too late to start building. So people have religious groups they can belong to, social groups they can belong to. They have support groups. There's so many virtual support groups, and I'm sure your organization has that as well, where they can have interactions with their peers and learn from them, share their challenges, and learn from their own experiences as well. So it is not a dead end for any woman who does not have or who is not having a smooth family relationship. It's not a dead end. Let her look on the brighter side. Let her go out, step out, look for groups, online groups that provide pregnancy support. Let her look into her, her social groups, whether it's in the community, whether it's in her religious engagement. She can actually identify with such groups. And she can look at extended families as well. Does she have a childhood friend she hasn't chatted in a very long time? Maybe now is the time to just go ahead and call that person up. It's either a yes or a no. You can start mending relationships just because you need help. But then, because the society we live in expects that the woman, regardless of what she's going through, be strong, it is assumed that so long as she's female, she should be able to handle it. I mean, pregnancy comes with being a woman. So she needs to understand that she's human. She needs to admit that she needs help. So when I had my last baby, I wasn't really prepared for that pregnancy. When I realized that I was pregnant, I knew that I did not have the mental capacity to go through that process. So I had to call my husband, thankfully. I had to call my husband and I had to express I'm usually this strong woman. I'm usually strong, there for everyone. But I had to tell myself at that particular point in time, hey, you need help. You can't go through this alone. So you need help. So we called for a family meeting. And my husband was, okay, so what do you need to make this process smooth for you? So he brought a sheet of paper and gave me a pen. I started listing out the things that I needed them to put in place to ensure that I am not stressed out. And they did. For the first 3 to 4 months of that pregnancy, I was non-existent in the house. I couldn't do anything. I didn't touch my laptop. I couldn't do nothing. So I had that support. But that signaled to me, if you could have this kind of support, imagine other people who may not have access to this kind of support. So, Julie, what are you doing? What are you doing about it? I knew I needed to step up my game to start educating families to understand that pregnancy is a family affair. Everyone has a role to play in the process of pregnancy. I had to start teaching and encouraging women to recognize that they are human and not super beings. It's okay to ask for help because she needs all the strength and emotional stability as possible to go through because pregnancy is demanding. When the child is born, it takes a toll on the woman as well. So it's important for her to understand that she can ask for help. And asking for help is not a sign of weakness. It's because you want to go through that process and you want to win the game. So you need that support to make that happen. So for the woman who isn't having that smooth relationship with her family, she needs to understand that it's not a dead end. There are many other ways, and she shouldn't feel guilty about it because
It's
sometimes
so right.
we,
And women,
yeah, she just
yeah,
shouldn't
women
feel
do.
guilty about it.
Yeah, they feel like there's this obligation to, be able to be that superwoman and can get everything done. And it's so silly. It's like, if we have a sick child, um, we don't expect to feel guilty about taking our child to the doctor for an opinion and for some help, right? With looking after this unwell child. In fact, if the child's unwell and you're not seeking a medical opinion, or you're not seeking help, that's kind of frowned upon, right? So,
Yes,
but when it's just ourselves, if we're saying we need some help and we can't manage this condition, the situation on our own, suddenly we're feeling like we're wusses and we're weak and we should be able to do it. And it's just so silly. We wouldn't do that to our child, but we do that to ourselves, which is actually doing it to our unborn child. So
yes,
it is silly. We're putting ourselves into stress that may be avoidable, at least reducible.
we
But I
do.
guess that whole psychological stress, has such implications, doesn't it? And stress on the fetal health and stress on the postpartum health of the mother, the fetal health because of the stress in the pregnancy, and stress on the postpartum health of the mother affecting how she works with that baby, bonds with that baby. What's your commentary around, those implications of psychological stress?
Yeah. Thank you. I had an experience as a nursing student when I was posted to the labor ward, the maternity ward. We were eager to assist mothers to birth their babies. And I usually would go for the cleaning of the baby after the baby is born. That's because I felt that I would be able to like take my time to properly clean the baby because I watched some of my colleagues do it. I felt that I was going to do it better. So when they rushed to kind of birth the babies, they would not be so eager to clean the baby. So I was okay. I will take that responsibility. So I had this baby, went on ahead to clean the baby up. I felt so excited. That was my first experience. And the mother had exotomy and it was being repaired at the time. While she was there on the couch being attended to by the doctor or obstetrician, I took her baby in my arms to her. I called out her name with a smile and I said, "Here is your baby." As I extended my arm towards her, the response I got was shocking. She swung her hand and said, "Take this baby away from me." Those were her exact words. The thought of what could have happened if I was not holding or if I did not hold the baby strongly in my arms, that thought till date has not left me. The fear of what could have happened. If I did not hold firmly on that baby, the move she made with her hand, that baby would have dropped from my hands. But then I asked myself a question. What could make a mother go through pregnancy, breast a baby, and then not want to see the baby? So it was a question. These are some of the things that led to the work that I'm doing today. I said, what could make a woman not want to see her baby after going through the pain of pregnancy, labor, and delivery? Also on social
Yeah.
media,
You're asking
there was a woman.
what on
Yes,
earth could have made, what stresses went through that pregnancy that was so extreme that
yes,
as soon as that baby's born, it's rejected. It was obviously rejected before birth, resented potentially.
yes.
Yeah, and you're so right. I mean, what could have been, what on earth happened to that woman in that journey that that was the outcome, right?
Yes, yes. So
The
I started
implications of
asking,
that stress.
yes, it is, it is. So I started asking myself that question. I went on to interview some women. I went on to research on why these things happen. I discovered there was something called postpartum depression, postpartum blues. I said, oh, that could possibly be the case. And what could lead to this is when she experiences stress through the pregnancy or during the pregnancy. And most times when the woman does not get support from the very significant person, which is the partner, which is the father of the baby, it means a lot to the pregnant woman to be supported by the father of her baby.
Mhm.
So where there is no support, that particular support is very crucial to the pregnant woman. She may have every other support around, but that singular support from the partner, from the father of the baby is very important. So when that is absent, it has a negative effect on the pregnant woman. And
Oh,
if it
of
is not
course.
managed,
And yeah, I mean, you
yes,
know that we all know that the healthier the pregnancy, you know, that
yes,
so often that will indicate, you know, a stronger and more positive bond that the mother has with the baby, you know, afterwards. We know that one, you know, it's 1 + 1 = 2 kind of thing. Um,
yes,
yeah.
yes. So there was a study according to the Biomedical Central Journal on Reproductive Health. They said that a strong and positive bond or relationship is assumed to improve individuals' positive interaction that can help reduce depression, stress, and anxiety, and therefore reduce the risk of adverse pregnancy and birth outcomes. So that's an outcome of a study that once a woman is surrounded by a positive relationship or a positive bond, then it improves the individual's positive interaction. So they're able to interact with people once there's that positive support around the pregnant woman. And then it also helps to reduce stress and anxiety. So the relationship the woman is exposed to during pregnancy would largely determine the outcome of the pregnancy, determine the relationship with the newborn and the care that the newborn receives. It also determines the kind of bond that the mother would have with the newborn. So taking into context our environment in Nigeria, for instance, there's always this friction that happens when a woman is pregnant and when she has a baby. So you will have the man say that since my wife got pregnant and since she had a baby, she has neglected me and my needs. This is from the man. On the other hand, the woman is thinking in her head, I didn't get myself pregnant. My husband, since I got pregnant and since I had the baby, my husband has been distant from me. All he does is work, work, work. So she's feeling in her head, I didn't get myself pregnant. I'm the one pregnant here. I'm the one breastfeeding. I'm the one who has to stop work. I'm the one who is unsure of my life after now. I'm the one not ready and all that. So the gap in communication, the lack of understanding of what it would require to be pregnant, to carry a pregnancy, and take care of a newborn affects the outcome of pregnancy, affects how a woman experiences pregnancy and how she takes she gets attached to her baby. So we've had cases where mothers give birth and they say, no, you cannot come between. Now they're talking about a newborn. You can't come between me and my husband. So the newborn at that point starts experiencing some kind of disconnection from the mother and the parent. But what we teach in family nursing, and why we make emphasis on attachment with family bond nursing, is this. The father can very well connect with the mom and the baby. So while the baby is still in the womb, we still have the fetus. The husband can come around. Once the woman sees that her partner is very interested in the fetus that they both produce, then she's more inclined towards her husband. So it's important for us to have that understanding because we experience that a lot. So when babies are born, we teach it on different platforms that women, you before your child was your husband, don't let the child come between you and your husband. But here is the baby who is almost totally and helplessly dependent on those that brought him or her to the world. The child cannot sort himself out, cannot bath himself, cannot feed himself, cannot dress himself up. So it is the responsibility of both parents to do that. So how about them coming to an understanding that, oh, we are having a baby, not my wife is pregnant. No. So
Yeah.
it creates that sense of inclusiveness. It creates that sense of togetherness. It creates that sense of you're not alone. This is our baby. Let's do what we can to take care of. So once the baby is sorted, I usually say one thing that the only responsibility of the mother that cannot be carried out by the father is one, to incubate the baby in the womb. That's one. And then secondly, to breastfeed. Even the breastfeeding now, technology has improved and has made it more interesting that the breast milk can be expressed, and then the father can wear the I think that an artificial I don't know what that is called, but I have seen fathers feed feed their baby with breast milk because they kind of wear it like an apron and they hold their baby and they're able to feed as though they are breastfeeding. That does is it strengthens the relationship between the father and the child. It creates a stronger bond between parents and the baby. So it's important for us to understand this. A whole lot lies on the shoulders of health enthusiasts, healthcare professionals to enlighten parents, couples, pregnant families, pregnant couples on how this process can actually be smoother, better, and more positive if we have that understanding that yes, it's a
Absolutely.
family affair. Yes, the women need the support, and at the same time, it benefits the family as a whole.
Of course. Oh, it's just beautiful. The work you're doing is so important. And yeah, very appreciative of your time today. And it's great to have those insights and you know, you're really hitting the head of the nail, that's for sure. Um, and giving that support to the woman, particularly giving the guys the confidence that their role is so critical and makes such a difference to the outcomes. We are running out of time. We're almost up to an hour now. So yeah, is there anything, Julie, that you would like to finish off with? Any other comment you'd like to add?
Yes, I would like to say that it's a collective effort that is required here. We need as many advocates as possible because the business of childbearing is not coming to an end anytime soon. We're continuously going to be having babies. So it's important to have more advocates for healthy pregnancy period, post pregnancy period. It's important to have many people talk in favor. We need people in positions of power that can influence policies. We need We need hospitals and institutions, healthcare institutions, to look into the well-being of the mother and the child. We need more families to be involved in that birth process, the pregnancy process, because at the end of the day, life will come to an end if we don't have babies. So why not just pull all the resources available to ensure that they, they reach their full potential of health and well-being? So this is a call to everyone on the surface of this earth who came by birth to advocate for a healthy pregnancy experience.
Fantastic. Thank you so much. And thank you to those who joined us here today live. That's always great to have our live audience here. And of course, there's, be people watching this later on as well. Just a final thing, Julie, do you want to just mention your contact details in case anybody further down the track wants to be in contact with you?
Okay, great. So I actually can be reached at thefamilybondnurse@gmail.com. And then across social media platforms is Julie Mogbo. On LinkedIn, Instagram, Twitter, and Facebook, you just search for Julie Mogbo, and my name
Excellent.
would come up. And I must say, Kathy, you pronounce that well.
It's not,
My name.
not too hard. And yeah, so their email address again is just thefamilybondnurse@gmail.com. So
Yes.
thank you so much, Julie, and wish everybody a wonderful rest of your day and rest of their week. And thank you so much, everybody. And thank you, Julie.